Idiopathic Scoliosis by Heeya S. Introduction. Adolescent idiopathic scoliosis, or scoliosis, is an idiopathic deformity in the spine in which the spine curves into an S or a C shape. The word scoliosis comes from the Greek root skolios, which means bent or crooked. Girls are 10 times more likely to get it than boys and need to be screened earlier. Many schools across Texas have screening programs for scoliosis. The way that someone is screened is that they bend down and touch their toes, and another person scans their spine. This is called the Adams Forward Bend Test. It is used to look for any rotation or curvature in the spine. As scoliosis progresses, the vertebrae and spinous processes in the area of the major curve rotate toward the concavity of the curve. On the concave side of the curve, the ribs are close together. So here's some spinal anatomy. So on the picture on the right, it shows the 5 regions of the spine. So the red region is the cervical region. It has 7 vertebrae. The blue region is the thoracic vertebrae. It has 12 vertebrae. The yellow region is the lumbar vertebrae. It has 5. The green region is the sacrum vertebrae. It has 5 fused vertebrae. And the pink region is the coccyx, which has 4 fused vertebrae. The sacrum and the coccyx are both inside the pelvis, which is the hip bone. On the image on the left, it has a picture of a vertebrae. So basically, the center part is the spinal cord, which is part of the central nervous system. And then there's the spinal nerves branching out from the spinal cord. And then there's the facets. Then there's the spinal joint, the ligament, and the side view of the spinal nerve. Types of scoliosis. So as you know, scoliosis is a condition in which the spine curves or twists sideways at least 10 degrees. So there's thoracic scoliosis, lumbar scoliosis, thoracolumbar scoliosis, combined scoliosis, and a healthy spine, which is not scoliosis. So basically, thoracic scoliosis is between the shoulder blades. Lumbar scoliosis is in the lowest part of the spine. Thoracolumbar is below the shoulder blades to the lower spine, so in the middle of your back. Combined is 2 curves in different directions, is extremely rare and is also called an S-shaped curve, and then healthy is not scoliosis. Treatment options. There are very few treatment options for scoliosis, but the 2 that work are bracing and surgery. Sometimes for mild curves, physical therapy is an option, but this is mostly used with bracing to have a more effective impact on the spine. Bracing. A back brace is needed when the curve is around 25 to 30 degrees. A brace works by applying padding to the brace, which then squeezes the spine into alignment. So the picture on the left is a person wearing a back brace, and the x-rays on the right are without the brace and with the brace. So you can see the brace is helping the spine to not curve as much and reducing the curvature, so it's working properly. Physical therapy. Sometimes, if patients do not want the curve to progress, they can do physical therapy to prevent curve progression. Typically, they can do the therapy with a scoliosis-specific therapist to ensure good results. Sometimes, patients can also visit a chiropractor to do the therapy. The method that the therapists use is called the Schroth method. Surgery. Surgery for scoliosis may be recommended when the curve reaches 50 degrees or more. The most common type of spinal surgery is the spinal fusion. It is when the surgeons attach metal rods to the patient's spine, so over time the rods fuse the spine. It is a very risky surgery and should only be used as a last resort. Another surgery is VBT, or vertebral body tethering. It uses a flexible rod instead of a rigid metal one. It has less risks, a shorter recovery time, and is overall a better option. However, there is a 31% higher risk for more surgery due to a progression of the curve or breaking of the tethers. There is also surgery called VEPTR, or vertical expanding prosthetic titanium ribs. It is usually used for people who suffer from rib deformities because of scoliosis, like fused ribs. Here are some more types of scoliosis. Congenital scoliosis. Congenital scoliosis is scoliosis that is present during birth. It is extremely rare and occurs in about 1 out of 10,000 newborns. It usually happens when the fetus is in an awkward position in the womb. It is usually serious and can affect the quality of life for the baby. Luckily, there are ways to treat it without surgical intervention. Typically, it is treated with a cast or back brace for babies. Sometimes, if the curve is serious enough, surgery may be required before the curve gets worse. Neuromuscular scoliosis. Neuromuscular scoliosis is the result of a traumatic injury like a car crash. Usually there are fractures on the spine, so the only option for treatment is surgery. Neuromuscular scoliosis is usually mild, but in some very rare cases the curve can progress. Hemivertebrae. Hemivertebrae are one of the root causes of congenital and neuromuscular scoliosis. If you look at an X-ray and examine the center of the curve, you will see a wedge-shaped vertebrae. This is called a hemivertebrae. It causes the vertebrae on the top and bottom of the deformed one to collapse and form the scoliotic curve. So basically, it's a deformed vertebrae. And in the X-ray, you can see that the arrow is pointing to the hemivertebrae. You can see it's kind of trapezoidal and deformed. Fun facts. Curves in the spine below 10 degrees are not considered scoliosis. If your scoliosis is more than 20 degrees, you cannot join the Air Force. Scoliosis is a condition that cannot be cured. The fastest runner in the world, Usain Bolt, has scoliosis. The best living cello player in the world, Yo-Yo Ma, had surgery for scoliosis. Guiding questions. What purposes does my topic serve? To inform people about adolescent idiopathic scoliosis. What would society/the world be like without my topic? Since my topic is a disease/condition, society would be better without it. Why would other people consider my topic important? It would help to raise awareness about scoliosis so then other people can recognize it. What may be the future of my topic? Treatments would be better and more effective. So here's my bibliography. And a lot of the sources came from my brain because I knew a lot about scoliosis. The end.